Everybody. I'm Dr. Vipul Janardan. I'm psychiatrist from Institute of Human Behavior and Allied Sciences, New Delhi. So I will be talking about schizophrenia. So schizophrenia is a chronic mental disorder that is characterized by like positive symptoms and the negative symptoms. Schizophrenia is characterized by distortion in thinking, perception, emotions, and language, and sense of self and the behavior. So there are positive symptoms like hallucination, delusion, thought disorders, and movement disorder as well. There are negative symptoms like reduced expression of emotions, lack of pleasure, difficulty in sustaining life, reduced speaking, poor social interaction, and the cognitive symptoms like poor executive functions, trouble focusing or paying attention, and problem in working memory as well. So the cause and the exact etiology of the schizophrenia is not known, but there are a lot of theories involvement like genetics, genes involvement, like dopamine, brain neurotransmitter, like dysregulation of the dopamine, and definitely the certain environmental factors. So schizophrenia is diagnosed by clinical evaluation. It includes the patient history, symptoms, and assessment. There are no specific lab test, but there are prodrome symptoms and other symptoms, other neurological deficits that can be seen in the schizophrenia. So in case of the treatment modalities involve the pharmacotherapy. These are uh, two types of medication, like typical antipsychotic medication, that are haloperidol, trifluperazine, and atypical antipsychotics. These are olanzapine and risperidone and others. So apart from that, we psychiatrists generally recommend to schizophrenic patient to do cognitive behavior therapy, and there is cognitive remedium therapy that is very important for them. And the bad thing about the schizophrenia is that they don't have insight about the illness. So insight oriented therapy is also an important part, along with the family support and other rehabilitation measures like skill training, vocational training, and support in day-to-day functioning. So schizophrenia is affecting around 1% of the total population. It impacts the day-to-day patient's ability to do the effective his day-to-day activity of living. And there is lot of misconception of the schizophrenia. Most of the people think schizophrenia is a split personality, but that is not the case. uh, Importance in the case of schizophrenia is family support and the good social network and the community resources. Suppose if any of your person, the above symptoms I mentioned, suffering from these, so you can easily send to the psychiatrist or the mental health expert, so that the person will not have so much disability, and the at the right time and the right point it can be halted. Research and hope is always there, so we are hoping for the best. And thank you very much about this.
Can I ask you something as a listener? Can you give some examples of stories of some, when you have not without with a name, but let's say some patient histories that people can understand?
Yeah, suppose a person came to me when I was in the clinic. So he was telling me that actually uh, his parents and the relatives has brought him to the clinic. He was having suspiciousness toward his family member. He was thinking that he was hearing some voices that is not here by the other person. So he keeps muttering to self and talking to self all the time, and he keeps wandering away from the home without any reason, without any purpose. So he moves, and sometimes he says that he has been possessed by some god, or he has some powers of god. God. So that time, their parents and the family members were very apprehensive, and he was at the time become very much agitated and aggressive. He even hit the neighboring the other family members, and sometimes he hit the neighbors. So this was causing lot of mishaps, and it was difficult for the family members to support him and to sustain life with him. So they bought to the psychiatrist, and before that they went to the some magic healers and other things, thinking that it is something happening because of some magic or something, because of the superstitious and the false belief they were having. So during that time he was taken to the hospital, and the medication was given to him. He was given to him, and he responded well with the treatment. And now he's following up in my clinics, and he's doing well, along with the medication and the therapies.
So can I ask you, so what medication are we talking about? So what medication did in this case,
What many?
what medication was working? Did you find the medication straight away, or does it take longer?
We have like given the, since we have taken the history from from the relative and the patient, and did the mental status, serial mental status examination. After that we started a battery of test. After that we started medication. We started at risperidone, so it worked well in that case. We started with 2 milligram, and then we optimized the doses to like 4 milligram. Then later on, that's the depending on the symptoms and the skills we applied, and it was like escalated to 8 milligram.
Mm.
And he responded well with the medication.
Is he back to the family, and how does it work? So is he, can he manage in the family now? Is he working?
Yeah, he was quite manageable. Earlier he was not going to the job, but now he was, as with the assistance, he was doing some jobs uh, like like helping in errands, and taking some groceries and other things. So he was doing quite well according to the family member. They were happy about that.
Okay.